Welcome to the webinar, everybody. Good morning, October 1st. Can you believe it? October 1st in a rainy Cincinnati.
Nope.
In fact, pretty rainy throughout the whole state. I drove the length of it yesterday. And today we're joined by Mitch Flowers, and he's going to do a preview of the 2025 plan preview. I'm going to roll through just a couple quick slides and then introduce Brad and Mitch. So you know the drill. If you got a question, put it in the question box, and we'll get to those during the presentation and after the presentation. And we're in the busy season now, and by all means, reach out to us about everything and anything associated with the individual market. That's our contact information. And check us out on social media and the Monday Minute, which is chock full of information. That's from Cornerstone. And so, Brad, I want you to introduce Mitch for me, if you could.
I thought you already did. Hey, everyone. Good morning. It is Brad, fresh back from Bowling Green last night. So I wanted to introduce our friend Mitch Flowers. He's got some really cool things to share with you all today. I heard a presentation last week, and I think there's a lot of good stuff that Mitch is going to talk about. Maybe he knows even a little bit more now than he did last week. So, Mitch, and I don't know if everybody's noticed, but I'm wearing my old UnitedHealthcare shirt. It's just a habit, especially when talking about UnitedHealthcare. So, Mitch, why don't you take it away? Jeff, you might have to transfer to
I
him.
think we did, yeah. We're cooking with gas
Yeah.
now.
You guys see it all right?
Fantastic. Yeah. Uh,
Okay.
yes, perfect. We're off and running. Thank you.
All right. And thank you, Brad. And thank you,
Yes, sir.
Jeff. Appreciate the time as always this morning. And thanks everybody for taking time out of your days to join us this morning for a 9 a.m. training, which is a little rare. So I appreciate everybody getting up early. And certainly this time of year, very busy for us all. So really appreciate everybody taking time out of their day and then wanting to join us to talk about not only Ohio this year, as you can see, we'll also be talking about a new state for us, Indiana, for 2025. So I'll be taking up that state as well. We'll touch on that, and looking forward to talking with you guys about some of the new changes coming this year, and some of the stuff will look familiar as well. All right. So a little bit about me, Mitch Flowers. I know I've spoken to many of you guys before, and to those that are new on the call, nice to meet you virtually as well. Like I said, I have been running the state of Ohio since we re-entered back in 22. Can't believe it's already been going into our third OEP now. So time has just gone by so fast. And like I always say, I want you guys just to think of me as your local resource. Like I said, I've spoken to many of you out there before, and I always appreciate when people reach out asking, how can I expand my book of business? What are your hot markets? Those kind of conversations, or even if you're getting involved in the community, ways that we can help sponsor. So reach out, don't be a stranger. I love communicating with you guys and helping you guys grow your book of business with us. And there's my contact information. And so really enjoy doing that. All right. So the agenda for this morning, we'll touch on first, we'll go over the UHC market overview. I always like to start with this just to give you guys an idea of our growth over the past 4 years. We really have just experienced a tremendous amount of growth, and we'll detail that. We'll then go into our consumer experience, also very important topic there. If consumers aren't having a great experience, they're going to go elsewhere. So we're going to talk about some of the changes on that front. We'll then touch on product offerings. So a lot of changes this year going into OEP 25 in terms of what carriers can offer in terms of products and the number of products we can offer. We'll go over that. We'll touch on network, and then we'll end on operational enhancements. And hopefully there's some time left for some Q&A. All right, so prepping for 2025, as I kind of just alluded to, there are several significant changes that will affect the market this year, not just with UnitedHealthcare, but in the market in general. And the biggest change really is going to be just the number of plans. So CMS has reduced the number of plans carriers can offer per metal tier. I'll touch on that here in a little bit. And that's really going to be the biggest area of change. And how how do we respond to that change while still offering products and things like that that consumers are going to want and that the market's going to want. So we'll go over that. But like I said, I want to start off with just telling a story of our growth and kind of our footprint and how it's changed over the years. And I want to just start off with our growth in terms of our member size here. And you can see just from this chart that we've really just grown so much over the past 4 years. I mean, you're looking at 23 to 24, almost doubled our growth, and we're now over at 1.5 million members. You know, we who would have thought we would have been, having this large of a size of membership this early on. So just want to thank you guys out there, because 60% of our growth comes from our distribution, such as you guys out there. So I want to appreciate and just extend my gratitude for you guys out there at Cornerstone and you guys and your hard work that you guys have put in these past couple of years in helping us grow our book of business, not only in Ohio, but all over the country. So thank you so much. And we hope that we provide you guys with a better footprint and better products year over year to help you guys expand that book. Speaking of our general IFP footprint, we've got one of the largest footprints in the country now. If you look at our growth, and we started back, like I said, in 2022, just in 18 states. We moved on to 22 states in 2023, up to 26 last year, and now we'll be at 30 states across the country. So one of the largest footprints of any carrier. Our 4 new states this year for 2025 are, like I said, going to be Indiana, Iowa, Nebraska, and Wyoming. Now, I know a good amount of Cornerstone folks out there sell in Indiana, so really happy to announce that expansion and really happy to be taking on that expansion as well. So we'll touch on the footprint a little bit later. But just as the overall footprint goes, we just have a massive footprint, and this is really all around giving our distribution more opportunities. So more footprint, more counties, more opportunity, of course, for you guys out there to expand your business into. So we'll now be at almost 150 markets this year, and a market you can think of just like as a Columbus, Cincinnati, Cleveland, like a large metro area, and also 1,200 counties. So a lot of counties, just a lot of opportunity to go along with the growth that this market has seen overall, explosive growth over the past couple of years. And 2025 should be another year of strong growth. So more opportunity for you guys to expand in. And this slide is just going to summarize what we just talked about. We're up to 30 states now, like I said, 150 markets almost, over 1.5 million members, should be probably close to 2 million by the end of this year. And so just a lot of growth. And a lot of that is due to you guys out there, our distribution channel. So thank you again. And we hope to even have a better year with you this year. All right. Consumer experience, very important. If a consumer is not having a great experience with us, they're going to start looking elsewhere. So we put a lot of investment, a lot of time onto the consumer experience front, and really just always trying to improve that experience year over year. And a big priority of ours in relation to that has been retention. So retention is an even more critical lever for our growth together as our membership popular growths. And so we've identified 3 ways we're able to really strengthen this front. So stable pricing. This is going to appeal to those price sensitive consumers and just every consumer as a whole. We know that this market is very price sensitive. So we really want to make sure our pricing is stable. We don't want those large fluctuations year over year that we've seen in other carriers. We might not be exactly the lowest, but we're not going to be coming in at the most expensive either. And so we're aiming for a competitive position all over. And so we really want that position to be stable year over year. We want to be that reliable partner for you guys. So that starts with that stable pricing. Targeted segmentation, say that 5 times. This is going to be using our data and some of our resources that we have, which we have a lot of, to target the populations that might be at a higher risk of retention or churn. And we aim more marketing resources at them in order to keep them in your book of business. And then retention incentives as well. So last year we implemented some incentives for having a higher retention in your book of business in addition to our other bonuses. And we'll continue to do that this year, most likely. We're still rolling out our bonus programs, but incenting our distribution by compensating for retention has worked well for us, and we'll continue to do that this year in addition to our other bonuses as well. And like I said, this is all just to ensure our members have the best possible experience which in turn keeps them our member, and of course, more importantly, keeps them your members as well. And so to close this part out, we want you guys to leverage our brand. It's stronger than ever. So in fact, it's up 5% year over year. It's as strong as it's ever been. It's up, like I said, 5% according to the brand survey rankings year over year. It's a trusted brand. It's a household name, and it's a name that people trust. And so we've got tons of resources out there to help you leverage this brand and help you find the best product for your members out there. And more on that here in a little bit. All right, so getting into network here. Now I want to start off with Indiana, new state for us, as I mentioned. And this is going to detail our footprint for year one in Indiana. As you can see on the map here, it is somewhat limited in terms of its size of a footprint this year. It's relatively small, only 9 counties. However, those 9 counties are going to be centered around the large population area of Indianapolis. So a lot of opportunity still to be had within those 9 counties. In fact, there are about 150,000 IFP eligible lives just in those 9 counties that we have. So really still a lot of opportunity despite just being in 9 counties. The plans will be non-gated, which is great. Somewhat surprising. Year one, usually we have gated plans, but we're going to be non-gated in Indiana this year, which just removes another step. Members won't need that referral to get specialty care, which is great. As for our hospital systems that we have so far, we have Community Health Network and its affiliates, and then we've also got Suburban Health Network, Suburban Health Organization and their affiliates as well. Now you can see that there'll be additional hospital systems pending. We've got our network team hard at work. Hopefully we can get some more systems in before OEP, but we've got 2 strong anchors for us as it stands right now in community and suburban. And if we do get some more partners in, I'll be sure to communicate that with Brad and Jeff, and we'll get that out to you guys as well. But these are going to be our 9 counties. As you can see here, Boone, Hamilton, Hancock, Hendricks, Henry, Howard, a lot of H's, Johnson, Madison, and Marion, right around that Indianapolis area. So a lot of opportunity to be had. Really excited about this, and we should be doing great in Indianapolis this year and Indiana as a whole. So it's going to be a great new state, and really looking forward to seeing how it performs. Now as for Ohio, so our footprint in Ohio for 2025 in terms of counties is going to be exactly the same as it was last year. So we're still in 42 counties, just about half of the counties in the state. Markets are going to be the same as well. So we've got all the major metro areas in network, of course. Some of the newer market areas from last year, Batavia, Lima, and some of the counties surrounding Sandusky. So giving us a pretty expansive footprint in Ohio. Like I said, all the major metro areas gives us an access, hundreds of thousands of IFP eligible lives. We've just had a tremendous amount of growth in Ohio year over year, especially going in from 23 to 24 this year, just a lot of growth. And once again, thank you guys for that. You guys were a large reason why we were able to see so much growth. So our footprint is going to remain the same. Couple small additions within that network. For those of you that work the Toledo, Sandusky markets, we will have Nationwide Children's of Toledo now in network, as you can see here on the network chart. And as for the other systems, big market areas, Cincinnati, I know where a lot of you guys are down there. Still, Mercy's our anchor down there. We've got Kettering Health up towards the kind of in between Dayton area. Christ is still in network, and Fort Hamilton as well. Columbus, a differentiator for us is having Nationwide Children's Hospital in there. So we've got Mount Carmel, of course, is our main anchor system, COPC, but we do still have Nationwide Children's Hospital. And like I said, big differentiator for us. I think only a couple carriers have them in, maybe 1 or just 2. So a nice differentiator for us here in the Columbus market. And so, like I said, yeah, the footprint's going to remain the same. You guys will have this updated provider list here. As I said, I will send a version of this presentation to Brad and Jeff, and they'll get that out to you. So no need to jot this stuff down. You guys will have this to reference as well. And then the last big change for Ohio is that we will now be a non-gated state. As you can see there in the quick state facts on the left side, the second point down, we will now be a non-gated HMO state. We were gated last year and the year before, and new for this year, we will no longer be non-gated, which is great. So that just, like I said in the last slide, it removes that barrier. Members will no longer have to seek that referral from their PCP prior to getting specialist care. So happy about that. Good to see that change come along. All right, product. So before I get into the specifics of products, just want to give you guys an overall
Mitch,
snapshot of, yes.
I hate to interrupt. Could I just
Oh,
answer a
go ahead.
couple questions about the
Sure.
network
Network.
while you
You go
have the
back.
slides on there? Sorry. Um, Mercy Springfield, is it the Mercy system in Springfield? Do you have that, or is it
For
still
which county?
Clark?
I don't think Mercy Springfield. Is it just called Mercy Springfield?
Mercy system.
Yeah.
Yes,
Mitch, you
Mercy
have
system.
every other Mercy hospital in the state. I gotta
Yeah,
believe that you would. It's not called
that's
out
what I'm. Yeah,
specifically.
if it's the name Mercy Springfield, I would assume so too, Brad. But I'll definitely check if that's
Yeah.
is that the actual name Mercy Springfield. I'll get on here and check after we
Yeah,
get
Matt,
off.
can you clarify that for us? The actual
It
name?
probably has a saint's name,
Yeah, that's what
my
I'm
guess,
thinking.
not
Okay.
Springfield. Yeah.
Yeah, maybe Matt can
But
clarify that
if
for us.
it's in the county of our footprint and it's a Mercy,
Uh-huh.
pretty high likelihood we'll have them in network. But I'll certainly double check if he gets me if just the whatever
I'll
name.
go on the website while you're talking
Okay.
on the consumer site.
Okay,
Yeah.
great. Thanks, Mitch.
Yep. Did you have another one, Jeff? Said a couple, or is that the only one?
Well, no, there's another question here. It pertains to are you traveling outside of Ohio? The question is travel within America covered? Obviously, it is for the emergency room, but to what
Yes.
extent is
So yeah. So we get that question a lot. We don't have cross state coverage right now. So your coverage is limited to the state in which you enroll in. So if you're enrolled in a plan in Ohio, you have to use it in Ohio. You can use it in the counties that we're in. It doesn't have to be specific to the county you enrolled into, but you can't like if you have a plan in Ohio and you want to go get covered in uh, Indiana or Kentucky, you can't do that. We don't have that nationwide cross border coverage right now. I know it's something that we are discussing. I know, I think, who has it? Ambetter might have something similar to that, but we do not have it right now. Possibly in the future, though.
right? Okay, fantastic. And I did get a clarification from Matt. He's talking about Mercy Health, the Springfield Regional Hospital. That's the name of it, Springfield Regional Hospital.
Springfield Regional. Okay. Matt, I'm gonna assume we have it in there, but I'm not gonna give you 100% certainty on it. But I will go in and check after we get off and confirm with you.
Okay, okay, fantastic.
All right. Good to go.
Good to go.
Okay. Good questions. Love the questions. All right, so just a general snapshot of our consumer here. Metal level enrollment, we'll start with that. So this has changed over the years, coming from a predominantly silver heavy market early on to now a bronze heavy market with nearly half of our selections coming on the bronze. That's no surprise to anybody. Ohio also a bronze heavy state. Interesting though, Indiana is a silver heavy state with about 60% of their selections coming from the silver tier. So a little bit of an outlier in terms of metal selection in that state. Generally speaking, on a national level, it's a very bronze heavy market. We know that consumers are wanting those $0 bronze plans, and so we'll touch on that here in a little bit. But no surprise that it's a bronze heavy market. Certainly it is in Ohio as well. Product family enrollment required, still a large percentage. Required plans are just those required plans that are required by CMS. So every carrier has the exact same plans. They're the plans that just, as the name implies, CMS requires us have. Our value plans, we'll touch on that in a little bit. Kind of a nice sweet spot. Touch on those in the next slide. And then, really shocking is our copay focus plan. So accounting for over a third of our plan selections. This plan has just taken off in terms of its popularity. It's just performed so well. It provides a lot of value. It satisfies a lot of needs that the consumers want in the market in terms of a copay style of plan. I'll go into the details on copay focus in a little bit, but just a really popular plan. Always a good option to bring up with your members. It's just been so popular, and we expect it to be even more popular this year as well. Member age, this has remained pretty constant over the years. Our largest cohort being that 30 to 49 group at 41% of our selections, pretty consistent with the market as a whole. But interesting, that 50 to 64 age group still accounting for 30% of our enrollments. Why is this important? Well, a lot of you out there sell Medicare, and so this is what we consider that pre-Medicare age is just a great opportunity to get them in your book of business on an IFP ACA plan, so that when they become Medicare eligible, it's just an easy transition into one of our industry-leading Medicare plans. So good opportunity to build that pipeline, build that funnel, and have them in your book of business for years. So that's just a kind of a general snapshot of our members, and pretty consistent over the years. Only real change is that's just a bronze-heavy market now, and we'll continue to expect that to be the case for the coming years. And so we've adapted accordingly with our plans, as you can see here in a little bit. All right, so I want to touch on product families next. And product families are just kind of our naming convention. You guys are all familiar with this. It's just an easy way to identify the plans and who they might be best suited for. So as I just mentioned, those required plans, also you'll see them known as the standard plans. These are just those plans that CMS requires all the carriers to offer. And there's different selections for each metal tier. In addition to that, I should have mentioned that these are going to be for Indiana, product families for Indiana this year. We'll have the value plan as well. So these are our flagship plans, nice sweet spot in terms of a moderate deductible and a lower premium. It has a nice mix of copays and co-insurance. So these are going to be a really good fit for most people. Always good to bring these up when you're having a consultation with your members, just to talk about, as they are like that nice sweet spot, and they're still very popular plan choice. And then our copay focus, as I mentioned, very popular. We launched it last year, just took off. And as you can see, these plans are going to provide that first dollar coverage. And they also have $0 medical deductibles with them. And so all of your most commonly used services are going to have a copay associated with them. And that's, of course, going to provide that cost transparency, more predictability with these plans. And so the market as a whole has really been after these copay style of focus plans. And this plan really actually came about after a phone call we had with one of our agencies. And they were just like, why don't you guys have a plan that just centers around copays? And, we're like, good question. And so we built the plan, we rolled out last year, and it just absolutely took off. And as you can see here, bronze, silver, and gold will have availability for all of these product families. Now, these are going to be product families for Ohio. So a little bit more options in this state, kind of a legacy state for us. So a little bit more options. Required, we'll have those. Value, we just talked about, we'll have those as well. Advantage plans are going to be one that we have in Ohio that we don't have in Indiana. Our advantage plans are going to be some of our richer plans. So these are going to have a lower deductible with a higher premium. So members that don't mind having a higher premium but lower out-of-pocket costs when they go and actually get care. And these plans are also going to have some copay elements to them as well. Not as much as the copay focus, but they will have some copay cost shares for services as well. And these are going to be available on the silver and gold tier. You might see a lot of our advantage plans with the adult dental and vision offering as well. And our value as well will have that. And so that'll be denoted by a plus sign at the end of the plan. So any plan that has an advantage gold plus, for example, any plan that has that plus sign at the end will let you know that has an adult dental and vision element embedded into it as well. We'll be continuing to offer a copay focus in Ohio. So glad that plan was our top selling plan last year by a country mile. And I assume it would probably be just as popular this year as well. And then we'll also be offering some essential off-exchange only product for Ohio as well. So only 5 states are going to have these product family available on the off-exchange: Arizona, Colorado, Maryland, Ohio, and Texas. So these are going to be your cheapest, skinniest, low-cost offerings. We know a lot of you guys out there sell off-exchange, and Ohio as a whole is a state with a lot of off-exchange enrollment. So happy that we will be offering some off-exchange items for you guys as well. Now, these are going to be our plan designs for Indiana. A lot to look at, obviously. And as I mentioned, you guys will have a copy of this, so no need to jot any stuff down. But as far as shelf space goes, we're trying to max out our shelf space. I mentioned the limitations this year in terms of plan offerings. So essentially you'll have a standard plan and then 2 other plans per metal tier. So it might sound like we kind of been calling it the standard plus 2 model. So you have the standard plan and then each carrier is allowed to supply 2 of their own plans. However, that gives you a total of 3, right? However, those plans can be mirrored identically with another plan that has dental and vision. And so you can have a max of up to 6 plans per tier if you really want to max out your shelf space. But really there's 3 plans. Those 3 plans can have a dental and vision element to them, and that allows you to add more shelf space. So really you have 6 max. And so we're going to try to max out that shelf space, as you can see here in our plan designs. But a couple plans just to call out: the copay focus will be available on all metal tiers in Indiana. And then we've also got some nice options. You can see the Value Plus, the Silver Value Plus, and the Gold Value Plus. Those adult dental and vision items. Options is there as well. And so in addition to those $0 deductible plans, a variety of different deductibles. And so it's really, given the limitations we've had, we're trying to create as much variety for the diverse needs of your clients as possible. So you see that in our plan designs here. And a couple other items we'll talk about later: mental health visits, right there in the middle. We've reduced cost on that for this year. I'll touch on that here in a little bit. Virtual urgent care, as you can see here, a lot of options with $0 virtual urgent care there. And some other benefits here we'll talk a little bit later. These are the same plan designs, just the RX benefits here. So still tier 1, going to be offering those 0 cost share preventative drugs. Tier 2, a lot of affordable plans there, some at $3, some at $1. And so still affordable prescriptions available on many of our plans, a big item there. These are going to be our plan designs for Ohio. So you can see here we've really maxed out the shelf space in Ohio, offering as many plans as we can given the limitations. So still have those copay focus plans, still have got our Advantage and Standard. And then you can see here as well, we've also got those off exchange plans in the red parentheses. And we even got some HSA options too. So HSA, still some enrollment in those plans, so they're popular with some. So we've maintained HSA plans in our portfolio. And so really maximizing the shelf space, giving you guys the most variety we can given the limitations. And so $0 deductible plans, nice variety of different levels of deductible. And so, giving your members different options. We understand there's different needs every time you sit down with one. So given the limitations, we feel that this is going to give us, the options to meet all the diverse needs that we come to expect in this market. And these are the RX, so similar tier 1, $0, and then affordable tier 2 and 3. And you guys will have this to reference. I'll make sure to send this out when we get after this call today. Just emphasizing the popularity of this copay focus plan. So I mentioned over a third now on this plan. It's got the $0 deductible, so really easy plan to sell. Affordable copays, affordable RX. And so, these are, like I said, designed to bring the most cost predictability and transparency for your members. Easy to sell with those $0 deductible plans. Very, very popular plan. So always a good idea to bring this plan up. When you're talking with your clients, it's just taking off. It's just been so well, provides so much value. And so really excited about this plan. All right, our vision benefit overview. I want to touch on our dental and vision. As I mentioned, some of our plans have those embedded Value Plus, Advantage Plus. And so the vision benefit is going to remain pretty similar to what we saw last year on the adult vision side. Now, pediatric dental and vision have to be embedded in all plans. We've always had pediatric dental and vision embedded in all of our plans, but now it's required by CMS. As for the adult benefits, pretty similar to last year, still no charge for the routine vision exams for adults. But the big change here this year is that we've increased our allowances this year, which is great. So it was $130 last year. It's going up $20. It will now be at $150 allowance for lenses and contacts things of that nature. So always great to increase the allowance there. Everything else will remain pretty similar to last year. Our dental benefit, now this is going to remain exactly the same as last year. I just mentioned pediatric, always going to be embedded. Adult dental side, 1,000 annual max still. Still no charge for class 1, your routine visits up to 2 a year on that at no charge. And then 50% co-insurances for minor and major. So these are going to be our dental and vision benefits now. These have also risen in popularity. More and more consumers are choosing plans that have adult dental vision, really give that full coverage. And so happy to still offer pretty nice benefits on the dental and vision side as well. And just rounding out kind of the other changes that we've made, some of the other enhancements we've made, enriching our plans. Behavioral health, we've lowered the cost of behavioral health office visits. We've seen the market and members are really asking for more robust mental health resources and benefits. So we've decreased the cost of that and added more to our plans. I'll get into the specifics on that in a little bit. We're also expanding $0 insulin to all of our plans this year. In addition to that, we've got $0 diabetes management care. We've increased that. So there will now be a total of 8 diabetes management services covered at $0 instead of 6 last year. We'll go over that in a couple slides. Adult vision, we just touched on that, increasing our allowance up to $150. And then with prescription, with the pharmacy side, $8 or less generic drugs will be offered, keeping affordable prescriptions a priority of ours as well. So just to summarize, some of the big enhancements we've made this year, starting at the top, the footprint now expanding. Actually, we'll be in 30 states this year, so I'll need to update that. Our virtual care, still $0 on most of our plans. Our mental health care, we're lowering the cost of office visits on that front. I mentioned our $0 diabetes management. We now have 8 diabetes management services at $0 to our members, and then $0 insulin on all of our plans. That's a big one. Members have been asking for that, and so that's great to have that on all of our plans. $8 or less generics. And then for our member incentives this year, another increase. We're increasing it from 100 to 150 this year. Is also be decoupled. So I'll touch on that in the next slide. To go with our other incentive, which is our fitness incentive, we'll continue to offer $0 digital fitness and then a new buyout program. And I'll go over the details of that in the next slide or two. But circling back to our diabetes benefits here, you can see all of our 8 $0 diabetes benefits. This will show you the existing benefits we had, the 6 free ones from 2024, but we're also going to be adding 2 more for 2025 at $0, routine foot care and nutrition counseling as well. So a total of 8 $0 diabetes services. We know, just the prevalence of this condition out there, just the widespread scale of it. And so always great to boost our diabetes benefits and services year over year. So now we have a total of 8 at no cost to your members at all. RX affordability, we touched on this, so really just the big points here. Those preventative $0 drugs will still remain at $0 at tier 1. Our preferred generics and also non-preferred generics will be reduced to a single preferred generic tier. That will be tier 2, just to make things more simple. And then also new for this year, 3-month refills for most maintenance medications will be available at all of our in-network pharmacies this year. They were limited to the number of pharmacies they were available at last year, but for those 3-month refills for those maintenance medications, they will now be available at all of our in-network pharmacies this year. So always great to hear that. All right, virtual care. So in terms of virtual care, this is an element of a plan that's grown in popularity. More and more members are getting comfortable with virtual care and are asking for that to be a part of their plan design. So we have incorporated different elements of virtual care on all of our plan designs. So virtual care, Galileo, as you might remember, is the provider for our virtual first plan, which is sunsetting this year just due to the new changes to the plan limitations. But Galileo will still be around. In fact, any member can select Galileo as their in-network virtual PCP if they so choose on any plan, regardless of the plan tier or plan that they choose. For urgent and on-demand virtual visits, we'll offer 2 options. So that will come in the form of Anwell or Doctor on Demand. So these Virtual urgent care visits are supported on these vendor platforms and will, like I said, be available to your members at $0. So a lot of virtual care elements still around. Most of it's $0, which is always great. And then, like I just mentioned a few slides ago, our members can now earn up to $150. So it was $100 last year. It will now be $150 for completing all the actions. And it's going to be decoupled this year. So a member is going to be able to receive that $100 simply for a PCP visit. So really easy. Just go get a PCP visit, and then you get a $100 incentive card. But new for this year, members are going to have an opportunity to earn an additional $50. Also pretty simple. They're just going to have to create their MyUHC account, turn on auto pay, and then opt in for the communications. All things that can be done really at point of sale and only take a few minutes to complete. And that member is going to have $150 in the form of a prepaid Visa card, as you can see there, that allows them to spend it wherever they want. So always good to offer more incentives year over year. And as you can see here, pretty easy for them to acquire. Just a PCP visit and a couple account-related activities, and they've got $150 to spend. Our fitness benefit will still remain. A little bit of change this year. So as far as the digital fitness goes, that's going to still be free, offered to all of our members over the age of 18 through OnePass. A massive library of over 40,000 digital classes that members have access to. And so really still popular with our members, and we'll continue to offer that $0. But new for this year, there's going to be a buy-up option for a physical gym membership, similar with OnePass. So members will have the opportunity to buy a gym membership. There's 4 different tiers, as you can see there: Classic, Standard, Premium, and Elite, ranging from price. Classic is going to be the cheapest, Elite is going to be the most expensive. But even at that Classic tier, which is relatively cheap, they still have access to over 12,000 gyms. So we'll see the popularity with that this year. You know, a lot of other plans have something similar to this. So the new buy-up option, they can choose from different tiers if they want to do a gym membership through OnePass. So in addition to the member incentive, the physical or the digital and physical gym membership incentives, we'll still offer our Walgreens over-the-counter discount as well. So this is that 20% discount available to our members on thousands of eligible Walgreens over-the-counter items. So any sort of over-the-counter item that you might see at Walgreens, our members get that 20% off discount still. Very popular with our members. Large utilization with this incentive. So just a nice way to add additional value to the plan. And in addition to that incentive card and the digital incentive as well.
And there's no limitations on that, right, Mitch? It's all year long, correct?
Yep, all year long.
Yeah,
all year
and
long.
no maximums like we see in Medicare. So
yep, good call out,
Brad. It's a pretty good thing.
Yep.
Yeah, sure.
Great point. No exclusions on this. And Walgreens has thousands and thousands of items, so a lot you can save on there, and 20%, pretty significant savings there. Great call out. All right. Operations. Everyone's most favorite and exciting topic. I can see everyone just bouncing for anticipation as we go into operations, but important nonetheless. And that's going to start with our new Jarvis homepage. We redesigned our Jarvis homepage to make it more simple. You know, we got a lot of feedback that just took a lot of clicks, and it was kind of tedious and time consuming in order to find what you wanted on the Jarvis homepage. So we've really just centralized the most used resources and tabs on Jarvis on the homepage just to make everything so easy for everybody. And I'll touch on that here a little bit. And in addition to that, you'll see our new sales and marketing page. So this is known as formally as the toolkit, the agent toolkit, which was available on Jarvis, but still it was kind of hard to find. You had to click a bunch in order to find where the toolkit was. So it's going to be renamed to our sales and marketing page, and it's going to be right there on the homepage for you. It's still going to have everything that you would expect from the toolkit in terms of marketing resources and how to and all kinds of stuff. Still going to have all of that available to you right on the homepage. And then new for this year as well, we've got our PhD Spanish language support. So we have a whole PhD team now that's dedicated to our Spanish speaking members. So that was a big investment. About half of our membership was Spanish speaking enrollees last year. So we now have a whole PH team dedicated to them. A little bit more on that sales and marketing page, pretty much the same as you would expect from that toolkit. All kinds of great materials on here. It's a lot of sales support materials, whether you're looking for Facebook ads, Facebook posts, different postcards, different flyers, all kinds of different stuff that you can share with your members or help your marketing efforts. A lot of it is at $0 as well, and it's customizable. So you can put your name and contact information on postcards and flyers and ads and download it at $0. So definitely encourage you guys, if you haven't checked it out or didn't check out the toolkit previously, to go in there and explore and just take advantage of the stuff that we're providing for you guys. Book to business touch points. These will also be available on here as well in case you're doing some emails to your members and just providing them with valuable communications the whole year. And these will center around renewals or onboarding and different other engagements. So if you're sending out an email saying, here's how you redeem your incentive card, here's how you set up your MyUHC, there's all kinds of different touch points that we'll provide to you. And you can just download it and send it out and make sure your members are getting the most out of their plans and utilizing everything that we have to offer them. And then event support items. We know that you guys, specifically at Cornerstone, you guys do a bunch of local events. And so there'll be different banners and tents and tablecloths and other UHC branded items on the tool, or you can call it the toolkit still, the sales and marketing page. And so if you guys are having local events, there's these items on here, but reach out to me as well. So we love to sponsor local events. If you guys are doing food drives or health events or what have you, reach out and we can get some UHC branded items for you guys and help you guys get set up. We really like doing that.
And why that's good, guys. If Mitch has it, you don't have to pay for it because those pull-up banners are about 70 or $80 a piece. Mitch, I'm guessing like Medicare,
Yeah.
some of the postcards and flyers all have a low cost, like 8 cents, depending upon how many you order. Is it the same?
Yeah, it should be similar to that. I'm not exactly sure on the pricing,
it starts
when
at
you're
10
doing,
cents and it goes down the more you order.
yeah, it probably is. And if, like I said, if you guys
Yeah.
are doing some support events and you need stuff like that, reach out to me. Don't go on there and you don't have to buy the banners and tablecloths. We'll set you guys up with that. But as far as the other materials go, a lot of it's free, like I said, and it's really just built around helping you market. And we know marketing is a key aspect in growing your book, and so we've got a lot of free items on there for you to help to market. So definitely encourage you guys to play around, and if you need help, we can do even another training on the toolkit and make sure you guys are all caught up. Jarvis, coming towards the end here. Jarvis, new for this year. Just those reporting features that were actually rolled out last year, but some enhancement to that. Downloading the app status report now. So if it's a late payment, things like that, you can see that. Your book of business, you can see your entire book of business as well. Agency reporting. So you guys will have access to this at Cornerstone. Jarvis homepage, we talked about that, and a redesign and the toolkit relocation right there on the main page will now be known as that sales and marketing page. So really just the reporting, give you more robust reports, late payment, turning 26, turning 65, more in-depth views of your book of business, more data for you guys to manage your books, what it boils down to. Just kind of went over this part, talked about that. Broker enablement. If you guys are anyone out there on the phone that's new to selling, we've got the Agent Hub, which is just a bunch of demo videos for you in case you're need to get caught up on our onboarding process or renewal process, all different kinds of 60-second how-to videos just in case you need to get caught up on any operations or just other parts of the business. And then getting towards the end here, just wanted to end kind of on compliance and some of our PhD. Compliance, big issue. We've all seen AOR change, crackdown from CMS. And so compliance is just a really hot topic this year for everybody. And so we've got a bunch of resources centered around compliance in case you need to get caught up and kind of the how-tos and what you're able to do and how to capture consent and all that stuff. We've got a ton of compliance resources. Not the most exciting topic, but one that we all need to pay attention to and make sure we're dotting our I's and crossing our T's with. So just know that we've got tons of materials on there to make sure that everyone's caught up with compliance and making sure that everyone keeps their book of business compliant and in their name and stays out of the naughty house on that. So a lot of resources there. And then producer help desk. This is our team. If you have any sort of go-to questions, day-to-day questions, this is the team to reach out to. I've supplied their information here. They're able to help with most things. You've got me, of course, but always start with PhD. They're able to provide solutions for most things, and we've expanded that team every single year to make sure we've got more people on staff, especially during this time of year. And so, great team there, and always a good resource to reach out to if you need a question. And then new for this year, just have a quick survey. So if anyone's out there and feels so inclined, we definitely value your feedback. So just a quick QR code. If you've got your camera handy, would really appreciate any sort of feedback we get. Our marketing team really loves that. So if you're kind enough, it's a quick 2-minute survey. Would really love the feedback. And with that, that's my last slide. So appreciate everyone sticking with me this time. Any questions that we didn't get to during the call, Brad or Jeff?
Yeah, this is a great opportunity for everybody.
Jeff,
Ask some
hang on,
questions. We do have a
Jeff.
couple questions. Yeah.
Let me share my screen real quick
Okay.
so
Please
I
do.
can answer Matt's question. It's easier to do it with pictures.
I see.
Yeah. So, Springfield Regional Medical Center, Soin also Medical Center in Springfield. Yellow Springs has got the Kettering Health Green Memorial, and then there's Mercy Memorial Hospital down the road in Urbana. So those are the 4 hospitals, Matt, in the area, or anybody else that's interested. So there you go. If you need me, Matt, to send an
Was that
email,
the
I
hospital
did a
that he
PDF.
referenced?
Yeah, it was the very first one that Matt
Okay,
asked
good.
me
So we
about.
are a network.
Yeah. Yep.
Yeah,
Yeah.
figured.
Yeah. And you got 4
I'd have to
hospitals.
call Mercy personally if we didn't have a network and ask him what was going on.
Yeah, right. I think I know him too. Mitch, really great stuff. Jeff, why don't you get to the rest of the questions? I'll stop sharing. Matt, maybe take a
Okay.
picture if you want to for proof in case your clients want to see it.
Okay.
So go ahead, Jeff. Handle the
Mary made the
questions. I'll leave it.
comment. Sure. Mary made the comment that Soin is a part of Kettering. Soin is a part of Kettering. So thank you for that, Mary. Another question. Only showing 4 plans as off exchange in Ohio to sell. So maybe comment on that. And
Mitch, go back to that slide, actually, if
Yeah,
you
I'm
don't
going
mind.
back. You'll have to let me share.
Oh,
But
yeah.
yeah, there's just 4 options this year. Like I said, in terms of the limitations and plans that carriers can offer this year, it just boiled down to that really and shelf space. And so that's really what it is. It just, there's limitations in the number of plans we can offer. The enrollment into
There it
off
goes.
exchange should be pulling up now. Enrollment into off exchange is, it's not like significant percentage, but it's still enough that it makes an investment in having some plan options. But just like I said, just the limited shelf space, limited offerings that we can offer this year was really just the biggest component into just having 4 options. But relatively speaking, most markets don't have any off exchange, so still 4 options there, some HSA options.
let me
Yep, I
ask you
think
this,
three
Mitch.
three of those
Oh,
are HSA options. One
mhm.
is a straight bronze plan. So
Yeah.
one at every
How
member
would
level.
Mitch? How would somebody apply for an off exchange plan? Do they use
So you can do El Sherpa. You can
Jarvis?
do Yep. So you can do well. So it's going to be our quote and enroll tool. When you're on Jarvis, you'll see the quote and enroll button. You'll hit that. That'll bring you to our internal quoting system. You can do it on Sherpa as well.
Okay, fantastic. And by all means, if you have any issues with either one of those systems, give me a call. We'll walk you through it. Next question is, um, so
Rates. What
Rates,
kind of
yeah.
yeah? What kind of increase or decrease, Mitch? Maybe a decrease would be
Well,
best.
there's a document out there. I'm sure you guys have seen it in terms of proposed
Kaiser Family
increase.
Foundation.
It's yeah. So I'm just told to recommend checking that one out. It's relatively low. There we are proposing increases, but compared to some of the other carriers, it's lower. Um, so in terms of what our position will be, we'll just have to see on November 1st, really, when we get all the other rates, and we'll be able to position ourselves. So it's just kind of hard to say at this point, but I will say that when we do get the rates out, we'll have a heat map tool that I've sent to you, Jeff, in the past that'll show you where our best counties are, where we're within X dollar amount of the lowest plan. And so that'll really give you guys, that's the best and most valuable resource I can give you guys is that heat map. And so when that becomes available, I'll send that to you guys and it'll show you where our most competitive counties are. And we can talk, we'll probably do another follow up call. We can talk about counties and hot markets and pricing when all that becomes available. But right now, it's impossible to say until we get those rates out from everybody.
You know what, Jeff? Maybe we'll send out that Kaiser Family Foundation as a part of the follow-up. That would
That's a
be
great
Yeah,
helpful
helpful
idea. That's a
for
great idea.
everybody.
but
Then
yeah, FYI, on
we'd
those
see
are
it all.
just proposed rates. Those are not final rates.
Yeah,
So
that's what's filed. So right,
That's a
anything
great
could
idea.
could
but it
change.
gives an indication, right? It gives an
Give us an
indication on trend.
indication. Yeah. So, but wouldn't take it as source of truth by any means, and we'll have to see on November 1st when our data teams get together and they start compiling that heat map. That's going to be the most valuable thing. And I think we should do another follow up call. It should be really short, but I'll just show you how to navigate our heat map. It's super in depth, very articulate, and you can dive into every county and see all kinds of different data. So be happy to do that for you guys when it comes out.
Yeah, we'll do that, Mitch. Just when you know
Cool.
that you're going to get it, we'll get something on the schedule for
Perfect.
an odd morning, other than Tuesday for you.
Cool. I have another meeting I got to jump onto at 10, another virtual rollout. Is there any other questions, Jeff? Could you just email them to me? They want me to join 5 minutes early just to make sure it's all
Will
checking out.
do. So far, nothing new came over, but
Okay.
Yeah,
Perfect.
so
Well, thank you guys
yeah,
for always
you're
for the
you're
time.
welcome.
I'll send the follow-up presentation to you guys, and we'll do another one. We'll
Yeah,
go over heat map
yeah,
and during
yeah.
OEP. But hope everybody has a great rest of the week. Keep sane during this time of year. Get some fresh air. Take a day off every once in a while. And
Some days.
looking forward to working with you guys.
Yeah, Mitch, go ahead. To everybody else, I just wanted to point out
Thank you
there's some
guys. Bye.
really great, that way you can go and I'll just encapsulate some of the things I heard that were
Bye bye. Thank you
important.
guys.
Yep, see ya. You got it. Guys, I think that 3-month refill at all network pharmacies, as opposed to a selected list, is really great. That 20% discount at Walgreens, people can use it all year long on Walgreens private label products. I usually, in any of the stores, when you look at the cost of a brand name, uh, indication, they're so much more expensive, and the private label brands are about a third of the cost. So, and 20% on top of that makes it a really good value. So, I think that's really great. Darn, I forgot to ask Mitch, and we'll ask him, and we'll send it in the follow-up email. The buy-up options for the gym membership, that could be really good because I can't imagine that it's going to be any more than $5 or $10 for that intro package. But when you start comparing some of those higher end, like the Lifetime, which could have a $85 monthly membership to have access to those locations. I saw Orange Theory, Pure Bar on there. So there's a lot of good stuff there, gang. It pretty similar to Medicare, except you have to pay for it in the marketplace segment. What else was good? That copay focus plan. So many people as Mitch said, are looking for a flat copay rather than a percentage and not knowing what it was. So again, that's going to be on most of the routine kind of care. What else? Am I missing anything? Jeff, anything? Was there anything?
I think we're all good. I
Yeah,
did want
there
to
was
point
something
out
about an
that,
incentive too.
right.
Yeah.
You got a great slate of plans there. And just want to point out, if you got any questions about anything related to the individual market, we didn't touch on ICRA, but that's certainly a great spot to park some of those off exchange plans. And really, that's about all I had. Any final
Yeah, and
thoughts?
gang, we'll need to regarding ICRA because we've been hearing it from a lot of the other carriers, and I'm not sure about UnitedHealthcare. If you're going to write an ICRA plan, there may be other off exchange plans available for ICRA specifically. We'll check on that because that's what we've been hearing from a few other carriers. And in some cases, it might be a slightly lower premium than the on exchange or even the off exchange plans for the consumers. So that's it. We're at an hour, so I'll shut up unless you have anything else to say.
I'm good to go. I'm good to
All right,
go.
everybody, have a great week. Take care.
Thanks, everybody.
All right, thanks. Bye now.